Welcome to the Healthy Heart Show, where we pull back the curtain on conventional medicine and dive into the root causes of cardiovascular health. If you are concerned about high cholesterol, high blood pressure, heart attacks, stroke, or atrial fibrillation, this is the place for you. We will provide natural heart information that will help you prevent, treat, and reverse any ailment, leaving pills and procedures out of the picture. Here are your guides to holistic heart health, board-certified cardiologist and Amazon best-selling author, Dr. Jack Wolfson, and natural heart doctor, naturopathic physician, Dr. Lauren Latanza.
All right, everyone, Dr. Jack Wolfson, board-certified cardiologist, here with another episode of the Healthy Heart Show, where we bring you the best information from the best and the brightest guests. And today, I think you're in for a real treat because, again, we've got Dr. Doreen Saltiel, medical doctor, who currently is in Asheville, North Carolina. Myself, she runs a holistic cardiology practice. And Dr. Saltiel received her medical degree from New York Medical College before completing her internal medicine residency at Brooke Army Medical Center in San Antonio, and then cardiology fellowship at Walter Reed in Washington, D.C., of course. And she also received her Juris Doctorate from the University of Missouri, Columbia. So she practiced cardiovascular medicine for 14 years in the Army. And then she was also the chief of cardiology. And following the 20 years as a interventional cardiologist, she practices functional cardiology, preventive cardiology, and total functional medicine. It focuses a lot on hormones and whatnot. In, again, her practice in North Carolina, she's the chief medical officer for Genova Diagnostics. And you know, Genova Diagnostics, they're one of the best diagnostic laboratories in the world, providing in-depth information as we all try and look for the cause of why people are sick. I remember Genova when they were still Great Smokies Lab, and that's when my wife introduced me to them years ago. So again, and Dr. Saltiel, she also teaches at A4M, the American Academy of Anti-Aging. And although they talk, anti-aging is in the title, and of course that's very important, but it also is about, again, root cause medicine, finding out why people are sick. She trained in metabolic cardiology like I did as well. So anyways, again, you've written so much, and again, you've authored papers and so much information. You've taught so many students, so many other doctors. Pleasure to have you on, Dr. Saltiel.
Thanks, Jack. Call me Doreen.
All right, Doreen, you got it. And as they say, call me whatever you want. Just don't call me late for any meal, because I love to eat food. I understand food is medicine. What is your dietary approach? And where did you formulate that approach? Because I assume you did not learn it in your extensive medical training and your years at Walter Reed, right, as a cardiology fellow. They weren't teaching you about nutrition, were they?
No. No, I learned most of it through my own research and reading about the Mediterranean diet and reading about the paleo diet, and then reading about all the different diets and figuring out what would work best for my patient population as well as myself. And I am more of a paleo with some carbs, healthy carbs, because the gut microbiome requires resistant starch to feed the enterocytes. But I lean more in that direction with healthy fruits and vegetables.
Fantastic. And, a lot of what we're going to talk about, we're going to dive into that area of the blood vessel, the endothelium and the glycocalyx, and we'll talk about that a little bit. But I think one of the fundamental things that really helps to nourish the endothelium, or the lining of the blood vessels, is sulfur, and those sulfur-rich foods. And correct me if I'm wrong, the animal foods are loaded with sulfur. We as humans need sulfur, and the animals need sulfur as well. So if we eat the healthy animals, we're going to get those benefits.
I agree. As long as they're healthy animals.
We agree to agree on that one. So point for us. Yeah, I never, ever consume anything that is not free-range, grass-fed, grass-finished. And actually, what we've been eating mostly these days is free-range bison, American bison, that are prairie raised, and they're field slaughtered. So they are not marched off to some kind of kill facility. They are actually killed in the field very quickly by gunshots. And if there is an ethical way to kill an animal, it is that. And because of that, again, it's the best meats. We never eat anything that's conventional. Again, conventional, as you know, full of moldy grains, full of GMOs, full of pesticides, and it's just not right spiritually in that area as well. All right, so in your teachings that you teach, and you talk a lot about this particular area of the blood vessel. Talk to the audience about this, the endothelium and the glycocalyx, and what it is and why it's so important.
Well, basically what I try to explain to young physicians or physicians who are not well versed in the cardiovascular arena or patients is that if we think of two things, if we think of a football team and a football, the glycocalyx is your front line of a football team. Your endothelium is the quarterback. And nitric oxide, which is that important signaling molecule, as well as molecule necessary for vascular tone, and it's an anti-inflammatory molecule, is the football. And so if you don't have a strong front line or a healthy front line in that football team, your quarterback or your endothelial cells are not going to be able to do their job. And so we, for years, talked about endothelial dysfunction as being the first step in cardiovascular disease or atherosclerosis, when in reality, it's violation of the glycocalyx. Because, if you violate the glycocalyx, that's where you're prone to getting endothelial dysfunction. That's when you lose that healthy signaling. That's when your quarterback can't throw that football. And so when I explain to people is that you have to have a healthy front line, you have to have a healthy quarterback, and you have to have a good quality football in order to keep the cardiovascular system or the blood vessel healthy. And it's systemic wide, whether we're talking about kidneys or whether we're talking about the brain or whether we're talking about the heart. All organs are fed by blood vessels. And so these structures are really important for overall health and wellness.
So I love that analogy again of the football field, and again the quarterback and what all that means, and also the football as far as how important nitric oxide is. I think that's a fantastic analogy. But as you're kind of talking about what leads to coronary artery disease, vascular disease, what leads to hypertension, I didn't hear you mention in this whole thing that people suffer from a statin drug deficiency, or I didn't hear you mention that that cholesterol, the good cholesterol, the bad cholesterol. How does cholesterol and LDLs, HDLs, how do they fit in this conversation involving the glycocalyx, the endothelium, and ultimately cardiovascular disease?
Well, we know that cardiovascular disease is a chronic inflammatory disease. You and I knew this in the 90s when Peter Libby wrote about this, and I, as an interventional cardiologist, said, oh, well, I just fix arteries. I don't have to read about this. And fast forward 40 years, and here we are, and it's what drives glycocalyx degradation. And all of the cardiovascular risk factors, whether we're talking about insulin resistance and diabetes, whether we're talking about high blood pressure, whether we're talking about oxidized LDL, because it's not just any LDL, it's the bad LDL, the oxidized LDL, the glycated LDL, which most commonly comes from glucose and elevated glucose. And so I'll take you back to diet. That drives glycocalyx degradation. And that's been proven in the literature. So all the risk factors, and then when we add stress to it and toxins, all of those things are going to damage that glycocalyx. Despite the fact that it's really easy to damage, it's also easy to repair. It's prone to be damaged, but it's prone to being repaired.
All right, so I'm listening to you, and you and I like just met. We've run in similar circles and stuff like that. But I'm just going to go out on a limb here and say I've trained with some phenomenal cardiologists, some phenomenal interventional cardiologists, but I never really got the sense from those interventional cardiologists that they were ever interested in why there's so much coronary artery disease, why there is and there are unstable plaques, why coronary artery disease forms. So I'm envisioning you, and you're in the cath lab, and you're fully draped with lead, and you're doing the procedures, and you're putting in stents. Where did this epiphany moment start for you to think about, wait a second, why are people developing coronary artery disease? And again, going after the causation. What was kind of the start of it for you?
Actually, I was still an interventional cardiologist and putting stents in. And then despite everything I did, they had restenosis. And so I used to say to people, see me now and see the bypass surgeon later, or see the bypass surgeon now and see me later. And it was at that point that I said to myself, wait a second, I am missing an entire, box here. My toolbox is only half full. And then when I read the Predimet studies and I read some of the, studies on dietary intervention and stress and obesity, I said, wait a second, time out. I need to take a totally different approach. And that was really when I started doing A4M. Was when I said, I need to do something different. And that's when I met Mark Houston. And I, at that point, said, oh, I'm going into rehab. I'm going into cardiology rehab, I called it, to learn really about root cause medicine and to really understand the whys behind it. And when I went to law school, you can never make a declarative statement when you're in law school. If you do, you always have to ask why. And so I started asking, why? Why do you have hypertension? Not you have hypertension here, let me give you an ACE inhibitor. Why are you tachycardic? We both know that a high heart rate is an ominous finding in patients. And why is your heart rate elevated? What's driving all of this? And I will tell you, when I shifted the paradigm, patients got better without stents. Patients got better without 97 medicines. And I still to this day tell people, you cannot out-supplement a bad lifestyle. So I can give you all the supplements in the world, but if you don't sleep, if you don't moderate your stress, and if you don't eat a healthy diet, not going to make a difference. And so that was the epiphany for me.
The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor. Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology Coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com. Now back to the Healthy Heart Show.
Yeah, and I think it's just the reality is, since the early 1900s, medical training has been controlled by the pharmaceutical industry, and again, that's all well documented in many different books. From Marcia Angel, former editor of New England Journal of Medicine. I mean, on and on, people talking about this. And it's just unfortunate because generations of cardiologists like us didn't receive that training. And it's not because they're not brilliant. I mean, listen, you're a brilliant, physician, and I've trained with so many others who are in that category as well. But it's just, it's all that they know. It's kind of like if someone said to me, "Hey, Jack, can you come help, me with the plumbing in my house?" I mean, I would be like, "I don't know anything about plumbing," and they would look at me like I was a total idiot. And it's not because I'm an idiot. It's just I've never been trained in plumbing. We were never trained in nutrition and causation. And I think also too, Doc, is that when people are critical of us, like, I'm very out there on social media. And when people would say, "Oh, you're just a pusher, for snake oil and supplements," and it's like, okay, well, yes, I do push, supplements and snake oil, if you will. And I think there is actually some data about the benefits of snake venom and snake oils and stuff like that. But that being aside, that's always, I mean, to me, and I think you would agree, there is a time and a place for modern medicine, but let's push it towards the end of the game as opposed to the beginning. So let's eat well, let's live well, let's think well. Let's do the most advanced testing in the world, like your time at Genova. Do the most advanced testing in the world, then use evidence-based supplements, of which I don't have to tell you, because like when Mark Houston talks, Dr. Mark Houston, medical doctor out of Vanderbilt University, he's not putting up fluff. He's not saying, hey, go eat the bark of a cactus or go off on some kind of crazy, tangent. It all comes from the medical literature that the medical doctors, unfortunately, they're not reading because they're not trained to read that. And then again, we test, don't guess, evidence-based supplements. And then Doreen, I throw in like other biohacking strategies, and that could be red light therapy or cold therapy or saunas, or IV. But again, let's when it comes to evidence-based, nutrients, let's talk about supporting the glycocalyx. Let's just dive into the product that you and I both utilize, and let's talk about Arterosil and how that can be utilized to help supercharge that glycocalyx and the endothelium.
Well, there are newer products. There are a lot of products now coming on the market about the glycocalyx. But the reason I lean towards this product is because it's evidence-based. When you look at the literature, well, it's rhamnine sulfate from Monastrum nitidum, and the 4 servings of the equivalent of fruits and vegetables from the Mediterranean diet. That's really what Arterosil is. And when you look at the literature on this green algae, there's some good literature out there on how it supports the glycocalyx, how it mitigates some of the cardiovascular risk factors, and how in and of itself, even if the glycocalyx is damaged, will be the offensive line, will protect that endothelium. And though no, they're not large randomized controlled trials because nobody can afford those. And let's be realistic, what's the matter with observational studies of real human beings in a non-controlled setting, which is really how we practice day to day. So you got to take the totality of the literature. And this product really is unique in its components because there's good literature behind this little green algae, I'll call it. And we know the data behind the Mediterranean diet. The Predimet studies. And so together, I think in addition to all the things that we do, it will heal the glycocalyx. It will support the glycocalyx. It will mitigate those chronic inflammatory risk factors that drive glycocalyx degradation.
When I first heard about the product, I'm like, well, it must contain sulfur, right? It must contain plenty of sulfur to help heal that glycocalyx. And the glycocalyx, again, is like these hair-like projections. And it's interesting, Doreen, is the sense of when we think about the glycocalyx, we think about this kind of like seaweed-like barrier that's like, swishing around on the bottom of the ocean floor, that's protecting the bottom of the ocean floor and stuff like that, all the things that it would, potentially do. And that's exactly what this product is. It's a seaweed product that, again, helps to support that glycocalyx or those hair-like projections that are swishing around, protecting the inside of the blood vessel. And when you do that, you're as good as gold. What are the situations where you like, or what clinical conditions do you like to use Arterosil?
Well, I use it both in patients with documented vascular disease, those who are high risk for vascular disease, and those who have other inflammatory diseases that a lot of people wouldn't think place them at risk for cardiovascular disease, like patients with rheumatoid arthritis, patients with celiac disease, patients with autoimmune disease, because remember, blood vessels feed every organ. And you and I both know, whether our audience knows, that patients with rheumatoid arthritis have a 1.5 times increased event rate, compared to the same population of patients. They're the perfect group of patients. And then I use it in a lot of reproductive age men and women who are going through IVF, because what they have shown is that this hyperstimulation syndrome that occurs when you give IVF damages the glycocalyx. And so it's really a very diverse product that, if you remember, every organ has a blood vessel that can be used to support just health and well-being. So if you ask me who I don't use it in, I can't even think of anybody who I don't use it in.
Right. There's really no contraindication outside of the obvious, again, like, allergy to the components of the actual product, and read the label and decide if you're allergic to any of those individual components, which I haven't seen personally. But again, it seems to be good for anybody and everybody, including people who are on anticoagulants. I'm not aware of any data that says, again, people who are on Eliquis, Xarelto, Pradaxa, warfarin, again, need to avoid it. And I think, if anything, I think, personally, without making any claims here, I think it helps to lower risk of cardioembolic events in people with hypercoagulability, or certainly people even with atrial fibrillation. For people who I see that I don't think qualify for anticoagulants, or people who don't want to take anticoagulants, it's one of my strategies that I use on top of eat well, live well, think well, right? Test, don't guess. And then again, the supplements that I think will be helpful, because again, the glycocalyx and the endothelium, right, that resides in the atria and the ventricles and the left atrial, appendage. It's right there. So if you make that area super slick, if you make that area Teflon, or like the outside of a fish, to again go back to that seafood, analogy, then nothing's going to stick to the outside of the fish.
I agree with you. I use it in everybody. And, the studies show it's immune modulatory, and it has similar or as good anticoagulant properties as heparin does.
And I've never seen any bleeding complications. Have you seen anyone have any bleeding issues with Arterosil?
No, and I see plenty of patients on, whether it be Plavix or whether it be Eliquis, whether it be any one of those things, and I don't stop it at all. Even in my diabetics, who I may use an increased dose because of their microvascular issues, and their just overall inflammatory, total body inflammatory burden.
All right, so because in general the dosing is 1 cap 2 times per day. So you talk
Correct.
about increased dosage. When do you reach for 2 caps 2 times a day?
In patients who are diabetic, in patients who initially have vascular disease, and then I may back it down. When I see patients, they have claudication and they have, they're not candidates for peripheral vascular surgery for whatever reason, or they have small vessel disease in their coronaries, but they still have angina. Those are the people I bump that dose, for a couple of months and then back it down.
So there's really no downside to doubling the dose, except for financial, right? You say, okay,
Correct.
well, listen, obviously,
Correct.
the product is not cheap. If and I like to say this too, Doreen, if the product does what we believe it to do, including some of their data about arterial plaque, reversal,
regression. Mm-hmm.
And if we can stabilize, the plaque, and we can reverse the plaque, like, what would that be worth to the pharmaceutical industry if we could prove, again, in massively large trials, which, like you pointed out, again, the funding, required to do that, if you look at some of the original statin data and stuff like that, 4S and some of the big statin trials, I mean, those were hundreds of millions of dollars spent on that, which is just not going to happen here. But again, I think, to your point, most people, or many people, certainly with vascular disease, diabetes, could benefit from the increased dosing. And I know you do a lot of hormones, a lot of people, men and women with erectile issues and erectile dysfunction issues, including women with erectile dysfunction issues as it relates to the female genitalia. And that, of course, the literature on nitric oxide support actually shows there may be some benefit in there, and also with Viagra and drugs like that in women. But let's stick to the majority. We can talk about men. In general, what are you seeing as far as men with erectile dysfunction? And maybe again, like, how, I know you get this question often, right? I'm spending this money on Arterosil or any of these supplements. How do we know it's working? So talk to me about ED, and talk to me, how do we know if the product's working?
Okay, let's start with ED. Yes, it does benefit those with mild ED. in patients who have severe ED, it benefits them, but it takes longer to see a benefit because they have such significant microvascular disease. As you know, as Graham Jackson said, erectile dysfunction is a cardiovascular disease until proven otherwise. And so, yes, that is one way it helps. The other thing that I see blood sugars coming down. I don't see people getting hypoglycemic, but I see blood sugars coming down. I see blood pressure coming down. I see diastolic blood pressure and systolic blood pressure. And you and I both know the small trial that was done out of Mark's lab. I don't think it was long enough to see the effects on systolic blood pressure, but there was a trend in it decreasing. But I've seen it come down where patients can actually get off their antihypertensive drugs. Their lipids get better. Their LDL particle number gets better. So those are the things I point to in patients. And I measure oxidized LDL. And so I show them that their oxidized LDL number actually goes down, and it's mainly because they have less glycated oxidized LDL. And so when I show patients this, they're more than willing to spend the money. And then, you can always do an endopat and show them that their endopat gets better. But if you and I are talking to the average doc who may not have fancy endopats or any of those fancy equipment, they could use just good old skills. And then I'll see C-reactive protein come down. And so I look at inflammatory markers. I look at all the things that I know Arterosil works on. Some take a little longer than others, depending on how well the patient participates in the activity.
Right. And I think, listen, for the conventional cardiologist, and I'm sure you'll agree, life was a lot easier as a conventional cardiologist, right? Somebody comes in, they see you again, they're in the midst of a heart attack, you do an angiogram, angioplasty, stent, they go home on 5 pharmaceuticals. Yes, very stressful and heroic, the work that you did in the cath lab. No doubt. But I mean, again, but your decision tree was super simple. Now you get into our space. And again, we're talking about these are the foods, and this is the lifestyle, and this is the thought processes, and this is the most advanced testing in the world. And these are all the supplements and biohacking strategies. And I think, to the question of like, how do we know something is working? It's like the whole program of what we do is working, right? So these are not things that we're doing in a silo compared to, well, here you are now, and now you take a statin drug, and here's your numbers later, and then you can decide whether or not it's working. What we do is we're doing all of these different things, and then again, endovascular, arterial, the endothelial health, the glycocalyx, that's part of the whole process. And I think, again, ultimately, hey, do your numbers look better? Do you feel better? Then we know the whole program is working, and Arterosil is part of that whole program.
Right. And the most important thing I say to them is, how are you feeling? And most people say, I feel better, when they participate in all of the things you just talked about. And, because you and I both have patients who just want a pill, and a pill is not going to fix anything.
Yeah. I mean, listen, I know you obviously, you after many years in your career in conventional, myself and many years in conventional, we don't have time for the people that just want to say, hey, listen, I just want to take the Arterosil. If you want to do that again, because I think also, too, Doreen, is that I think about this, that, we don't want people to show up in the emergency room and like, who's your cardiologist? Oh, I see Dr. Doreen, Saltiel. Oh, she was a phenomenal cardiologist, Walter Reed trained, years in the, in the cath lab, tremendous interventional cardiologist. And then she heard about, causation, and she went off the deep end. And that's why you're here, because she wasn't doing X, Y, Z on you. Like, we don't want that. So it's like you have to follow the whole system. What I would say, again, eat well, live well, think well, test, don't guess, evidence-based supplements. And the data that we have on Arterosil, I think, as far as this supplement space, is pretty impressive when you look at, again, these clinical trials that we do have that does show efficacy. And I think, again, it's a very exciting time for, holistic cardiology, natural cardiology in general. And, again, having products in our wheelhouse to use like Arterosil.
I agree.
All right. Well, listen, it was a pleasure speaking with you about this topic of endothelial health, the glycocalyx. Dr. Doreen, for anyone who wants more information about you, where can they find you?
My email is dsaltiel, SALTIEL, at yourtotalveincare.com.
Love it. Okay, we'll put all that into the show notes. And again, Dr. Doreen, I appreciate you being on. Everyone else, Dr. Jack Wolfson, another episode of the Healthy Heart Show. We'll see you next time.
That does it for today's episode. Thanks so much for listening to the Healthy Heart Show. Please help us get the word out by liking and subscribing to our podcast and our Facebook page, Natural Heart Doctor. Please show support for our podcast sponsor, Cardiology Coffee, your resource for organic, antioxidant-rich, mold and pesticide-free coffee shipped straight to your door. Learn more by adding @Cardiology Coffee on Instagram and visiting cardiologycoffee.com. This podcast provides materials for information and educational purposes only and should not be considered medical advice. We encourage you to contact your physician for any of the health issues discussed here.